Buongiorno and welcome back to Milano. Hey, I'm your host, Con Jackson. We're getting you connected with the second largest city in Italy and home to many gems, including Leonardo da Vinci's Last Supper, this beautiful cathedral behind us, and I'll reveal that in a moment, but that's a hard gem to hide because you can see it right now. And it's also home to the fashion houses Gucci, Prada, Armani, Versace, and Valentino, and more. And we'll be getting you connected with the fall fashion in just a moment. But first and foremost, it's time for Health Beat. Each and every week, we like to keep you a healthy environment so you can enjoy the world and all its wonders. And right now, we're going to be talking about fainting with Dr. Nichols and Trudy. Welcome to Get Connected.
Hi, Con. Thanks for having us on today.
Well, Trudy, let's start out with you. Can you tell us a little bit about the situation that started unfolding for your daughter?
Yeah, when Francesca was 10 months old, she started to faint. And obviously, any mother, panic, imagining terrible things, went to the doctor, told there was nothing wrong, it was normal. But it didn't seem very normal to us as a family. And this kept reoccurring. And so I started writing to doctors, and it took 3.5 years and several tests, several doctors' visits, before eventually she was diagnosed with syncope, which is the medical term for fainting. And I was asked to establish STARS, the Syncope Trust, to reach out to others and provide information support, because at that time there was no treatment and it was just something we had to learn to live with. However, fast forwarding now 18 years later, my daughter's 22 and doing well, but there's still so many people fainting. 50% of the population here in the States will have experienced a faint at some point in their lives and doing nothing about it. And it is not normal to faint. So anyone with an unexplained loss of consciousness faint, whether it's a one-off occasion or on numerous occasions, should urgently be seeking advice, medical advice. My husband 3 years ago turned to me and said, "Trudy, I'm going to faint," and with that he dropped dead. And we've all heard of basketball players on the field. We've even witnessed some of those on TV where they've just dropped to the floor and died. And the only symptom they may have had is one previous faint. So fainting is never normal. It can be something that can be easily treated, but it has to be diagnosed. And for others, it is a potentially life-threatening heart rhythm disorder and urgently needs to be seen. So this campaign, TakeFaintingToHeart.org, is about urging anyone who has fainted, whether it's once or numerous occasions, to go and seek medical advice from a heart rhythm specialist, such as Dr. Tulo, who's with me here today and working on this campaign.
Wow, Trudy, we are so glad that you started the organization STARS. But when your daughter lost consciousness, and this is, something parents we should all know about, what we should do if that happens.
I had no idea what had happened. I just couldn't believe my daughter was lifeless on the floor. She was just tiny. And then it happened again 2 weeks later, and then it started happening up to 8 times a day, which is extreme. It doesn't normally happen that frequently. So we were out of our minds with worry. I've since learnt that any age can experience these fainting attacks, and 50% of the elderly who experience falls and broken hips, etc., it's due to a faint, an unexplained loss of consciousness. So irrespective of age, fainting can strike with anyone. And certainly, as a mother of a young child, it was horrendous. But we learnt to cope with it, and I was lucky that I found expert doctors, and this is why I want to reach out to others to make sure that first and foremost they seek medical advice, whether that's with their primary physician or at the ER, but to ensure if they download the checklist from TakeFaintingToHeart.org, that will help them be prepared for the doctor's visit. It will help the physician as well answer the questions and ensure that they're seen by a specialist, because this isn't a campaign about raising millions of dollars for research. We know what's happening, and seeing the right doctor, it's fairly simple to diagnose either with a simple EKG, or in some cases the EKG is normal and it only shows up when they're having an episode, so they can have an implantable monitor, a recorder, that 3 months, 6 months, a year down the line, when they may faint again, we'll capture that event and help the heart rhythm specialist, and that's a cardiologist with a special interest in heart rhythms, an electrophysiologist, who can analyse the results and either treat with medication, lifestyle improvements, or in more serious cases with a pacemaker or an implantable defibrillator, and lives can be saved, and quality of life. A third of patients diagnosed with epilepsy actually do not have epilepsy, and many of these have underlying heart rhythm disorders. So we're reaching out to anyone and everyone that faints to ensure that they have the appropriate test and diagnosis and treatment.
Well, Trudy, I can only imagine how scary that situation was for you and your family. Doctor, medically speaking, what happened?
Well, most people don't realize what causes fainting is a sudden decrease in blood flow to the brain. It can be due to a drop in blood pressure, but in Trudy's daughter's case, it was due to the heart actually stopping. And that can occur under certain circumstances, but it cannot be diagnosed unless the patient sees a specialist and has special monitoring to actually document that. It's an unusual cause in a young person, but in older people, fainting is often a sign of serious heart rhythm problems. And that's why we're trying to get people to call their doctors if they ever faint so that they can get the proper evaluation and see a heart rhythm specialist like myself and get the proper treatment, because fainting is never normal.
Certainly interesting words. And Trudy, in closing, given what happened, tell us about how you feel about what emerged from the situation.
Most rewarding part is that she's a 22-year-old, she's graduated from college, and she's working for the organisation, and she's reaching out and helping others, and I'm extremely proud of her for doing that. She was determined not to let her loss of consciousness. Her childhood was blighted. She wasn't allowed to do so many things, and I had to go on every school trip and every swimming class and everything, and she was determined to be an independent individual and that she's helping others in similar situations. So that's the most rewarding, and as a parent, I'm very, very proud of her.
We thank you both for joining us, Trudy, Dr. Nichols, for your words of inspiration, making us more aware and being champions for this cause.
Thanks
Thank
for
you.
having us.
Well, each and every week on our Get Connected show, we do a segment called Health Beat, and you can check out previous versions, including this one today, on our Get Connected website at contv.com. And we're going to connect you with that Gothic cathedral behind us. It's one of the most recognized in the world, but there's one gym in there that very few people know about, and we'll detect it and uncover it together when we come back. Thank you so much for watching. Are you tired of negative news? We are.
And that's why we're creating a movement.
By keeping it real.
With what you need to know.
It's more than what's happening.
It's bringing hope back to our lives.
So go to contv.com and join our movement.